ओपन हार्ट सर्जरी, ये सुन के आपको डर लग सकता है, राइट? कोई बात नहीं। दिस इज द वीडियो यू नीड टू सी। One of the several reasons for open heart surgery is heart valve replacement. मतलब हार्ट वॉल्व रिप्लेसमेंट का मतलब यह है कि आपके हार्ट पे 4 वॉल्व होते हैं, उनमें से अगर एक या 2 खराब हो जाए तो उनको चेंज करने की जरूरत पड़ जाती है विथ एन आर्टिफिशियल वॉल्व। नाउ व्हाट्स द प्रोसीजर? चेस्ट को काटना पड़ता है, डिफेक्टेड वॉल्व को बाहर निकालना पड़ता है, एंड आर्टिफिशियल वॉल्व को अंदर डालना पड़ता है। But the thing is, on an average 7 to 10 days might be taken for each patient to come home. What if there's an option that a patient can go home in just 3 days with a brand new heart valve? And note this, without having to go through a very long and risky open heart surgery? Surprised? Curious? Well, to tell us more is Dr. A.B. Gopalamurugan.
There was a time when open heart surgery was the only option. Patients had to go through considerable hardships to survive and come out of an open heart surgery successfully. With open heart surgery, the post-op care and recovery is long and exhausting. Not to mention the physical toll the body has to undergo with open heart surgeries. Often, elderly patients are unlikely to return to their normal quality of life after open heart surgery.
Basically, an open heart surgery is too long, takes too much time to recover for the patient. तो आप पूछेंगे तो फिर और क्या? Well, there is a faster, easier and more efficient way of doing exactly this.
Transcatheter heart valve replacement. We were one of the very first to introduce transcatheter heart valve replacements to India back in the year 2010, and ever since we have treated hundreds of heart patients successfully.
Only a few skilled specialists across the world can actually perform this procedure, and Dr. ABG and his team of skilled specialists at the Heart Valve Center in India are one of them.
Transcatheter heart valve replacement is heart valve replacement without open heart surgery. It's a minimally invasive procedure where a new heart valve is implanted into the patient but without any surgery.
So what exactly do you do, doctor?
So this is the catheter and this is the valve. Using this plastic tube, this valve is taken all the way to the heart where it's implanted without opening the chest. We insert this catheter through a small opening in the groin and go all the way to the heart. When we reach the diseased valve within the heart, we replace it with this new valve. And because there is no large incision or breakage of the bone, the patient recovers within a day or 2.
Wait. Did you just say?
Yes, they do recover in just a day or 2. They're back home living a full life in no time at all.
That definitely sounds better than being stuck in a hospital for 7 to 10 days. Any day.
Yes, it is. Now, there are 2 main kinds of valve replacements. One is TAVR, that stands for transcatheter aortic valve replacement, and the other is TMVR, which stands for transcatheter mitral valve replacement. TMVR is slightly more complicated to do because of the way the valve is positioned within the heart. It needs a bit more expertise and it's been out there for just less than 15 years. But I'm proud to say that we performed the first ever TMVR successfully in this country, and therefore today he's the longest living TMVR patient in India.
Wow. Okay, wait, but there's more. Dr. ABG and his team of specialists actually hold a Guinness World Record of performing 20 TAVR surgeries in 1 hour across the world.
Whatever happens in the world, be it COVID or anything else, heart disease continues to be a major killer. To get the word out, we came up with this concept. We got together 20 leading heart centers across the world. The intention was to perform 20 TAVRs across time zones, all within 1 hour. We coordinated all these centers through a control room here in India, and all 20 patients had a successful TAVR and walked home in a day or 2.
The world is moving fast and so is modern medicine. Now, when you talk about open heart surgery, well, they've saved a lot of lives and they continue to do so. But there's a new player in town. So the next time someone in your family, any buzurg, needs a heart valve replacement, make sure to ask the doctor for a safer, more efficient and less complicated procedure, transcatheter procedure. And make sure to check out the Heart Valve Center in India. Bye-bye.